quite often a question that we get with students and therapists and graduates is that, okay, I want to learn more tests. I want to know, more tests and throw some more stuff at it. While they can help, they can also be a hindrance. So it's about making sure that we can use these tests appropriately and ask the right questions as well. And which will then, in turn, hopefully begin to target and refine our massage interventions a little bit more. Again, directly correlating with the effectiveness and the outcome of our clinical reasoning or our clinical outcomes. And then reassessing outcomes with using functional measures. A big one that I'm a fan of is something called patient-specific functional scoring, which those of you that have trained with us in LSSM will have heard me bleed on about that on a number of occasions. And funny enough, it's the first one up on our protocols this evening.